So this is Marissa. She's my patient that has Dupuytren's with Contracture. She's going to tell us her story.
Hi. Yes, I have had Dupuytren's for probably 7 years, but during the pandemic, it really progressed. My pinky was especially contracted, and I had seen, I don't know, at least 5 different specialists, and they told me that if it got worse than a 40-degree, 45-degree contracture, like this type of a bend, that they wouldn't be able to straighten it again, even with surgery. I found out about Shockwave therapy and that they were using it with success on Dupuytren's patients, especially in the UK. In 7 sessions, it's gone from 45 degrees to 18 degrees on the dorsal side and 15 on the palmar side, and that's miraculous. The occupational therapist said she can feel in the cord that the quality of the cord has changed and it's far more supple, and it just keeps improving. So I'm extremely grateful.
Yeah, that's great. Right, and Shockwave is so effective because Dupuytren's is so fibrotic. If we can do anything to loosen the tissue, to make the cords and the nodules, as you said, more supple, and to get rid of the contracture, that's amazing. So I start off with my radial Shockwave. I have the D15 tip in. I'm going to do it at 3 bar. I've been able to work up to 3 bar, which is pretty high. And my goal with this one is to have that anti-fibrotic effect, but also to numb it out, because the focused I will do at 30.35. And what we need to do with Dupuytren's is we need to do increased intensity to have a good effect. Okay, so I'm starting at 3. Like I said, I am basically trying to numb the tissue.
And I've learned so much, because I would never have imagined that there was scar tissue, for example, in my wrist or in other parts of my hand. But because we've been experimenting, and also because the initial pinky contracture has improved so much, Sharon's been working on other parts of my hand, and I'm able to understand that this localized inflammation is causing scar tissue in multiple places, which are being treated by Shockwave. And that's not something you could have in any other treatment.
Yeah, and so I also will treat the forearm muscles.
It's truly remarkable, because I've been doing research for over 7 years, maybe 8 years, and I have never had this type of success. In fact, every other hand surgeon, every other specialist told me there was nothing they could do for me until it got bad enough that I needed surgery. I want everybody to know about this option, and that it really is worth exploring, even paying out of pocket, because if I had known about Shockwave years ago, I would have done it.
This is the Focus Shockwave, and we've got it up high at 0.35. And typically, we don't use Shockwave this high unless we're working with bone healing, stress fractures, non-unions. Then we need it to be very high. But also with Dupuytren's, we've got a lot of dense tissue to break up. The time I'll turn it down will be when I check the median and ulnar radial nerves at the wrist, just because nerves don't like it to be super intense. We tend to do more nano intensity. The other beautiful thing about Shockwave is that if you have had any of these procedures, like the enzyme injection or the open hand surgery, even radiation, Shockwave can be excellent to heal the tissue after those procedures, because it's really amazing for wound healing. So a lot of practitioners will suggest doing Shockwave after the more invasive procedures, just to have the best results with skin healing and wound healing. And this is just right to help kind of clean everything up, because the better this whole area functions, the least likely you are to perpetuate more contracture. I try to do a minimum of 2,000 pulses. Oftentimes I get up to 3,000. With my Radial Shockwave, I aim for like 3,000 to 4,000. So that's a significant amount of pulses altogether. And then with most things in Shockwave, you just do a course of treatment and typically you don't end up having to revisit it. It usually heals the tissue really well, and then people are released, and as we know, it continues to heal the tissue 2 to 3 months afterwards, if not up to 12 months. But with Dupuytren's, there's such a genetic component that we just, you keep an eye on it, and if you feel like the contracture is getting worse again, then you come in for a few visits, and certainly better than having to do surgery. Yeah.
To me, you're my miracle worker, and I want the whole world to know about you.
That's great.
It's
Thanks.
true. It's amazing.